Hello, my name's Lisa Nobes. I'm Director of Nursing at Ipswich Hospital. So we're a medium-sized district general hospital and acute provider, but we also are in a joint venture with some of our colleagues across the county providing community services for Suffolk. The challenges that we face from a workforce point of view is really is not being able to get enough, basically. So across medical and non-medical clinical professionals, and really all professional groups now, we have vacancies, we have higher demand than we have the capacity to provide through our current workforce. So the benefit that the Good Practice Guide has is really pulling together all those really good examples of where things have worked really well. So that our example, for example, the practice education based learning has been through many kind of iterations to get it where it is. And rather than reinventing the wheel, it's really nice when you can turn to a guide that says, you know, this is how we solved that problem. So another benefit that it gives you is that you can contact people and have that kind of that discussion, just that real sort of honest discussion around how did it go, what were the challenges you found, if you were doing it differently, how would you do it, you know, going forward, and that's always really helpful. The example that we have in the retention in training part of the Good Practice Guide is a model called Pebbles, and that's about practice education based learning. So this is a model that really looks at a coaching style of supporting students in their practice placements. And we wanted to move to a different way of supporting students in placements because we recognised that when students were qualifying, they weren't feeling confident. They felt that they hadn't had enough opportunity to develop their leadership skills, and there was a big jump from third-year students into the preceptorship programme and registered nurse. So we wanted to develop a model of support that really changed the way students worked in practice. So this is really based on a coaching model, and student, rather than being placed with a registered nurse, they will be allocated to a learning bay. So you may have 3 students in a learning bay of 6 to 8 patients and a coach that is overseeing. So the coach will be a registered nurse that may be working in the bay with them or may be working in the next door bay, but still retains accountability for those patients. One of the students will take the lead role and will oversee and support the other students in delivering care to those patients, and that will be all care apart from anything that a registered nurse is required to do. So they will be working with the multidisciplinary team and they will be delivering the care. What's then built into the day is a learning hour. So the students negotiate that learning hour with their coach and their clinical educator, and they will identify something that they want to learn from caring for those patients. So it could be specifically related to an element of care, it could be about falls prevention, it could be about a certain condition, and they will go and either access the library or access specialist practitioner advice, and will spend an hour researching and understanding that problem, and will then come back and have some reflective time with either the coach or the clinical educator before applying their new knowledge to caring for those patients. The university has been evaluating alongside us so that we've got that rigour of evaluation, and we also obviously evaluate the students' experience during each placement. And from that evaluation, what we've learnt is that students feel a lot more confident. They have confidence not only in their care delivery skills, but in their leadership and their delegation. They have more confidence talking to other members of the multidisciplinary team, because obviously when they used to work alongside a registered nurse, the doctors and the therapists would always go to the registered nurse, whereas as part of the preparation, the whole MDT understands that if there's any issues with patients or ward rounds, they liaise with the students. So students' confidence has been built up through that. The other things that have come out of the evaluation is around the practice theory gap. Students feel that there's much more alignment from theory into practice, and some of that seems to be just from their ability to go and spend an hour just looking into theory related to the patients they're caring for. The preparation to make sure the coaching model worked was really key. It's a different way of supporting students. So there's a clinical educator that is allocated to a pair of wards, and part of their role is in preparing the clinical environment and all those that work in there, really, not just the nursing mentors and coaches, but also the whole of the multidisciplinary team and the support staff in delivering a coaching style, and understanding that actually those students will be responsible for delivering care. So there was a lot of preparation that we did with wards, getting them to understand what coaching means and getting them sort of prepared for the launch of Pebbles. We have seen a reduction in attrition, and that's really important to us, obviously, to make sure that we retain our students. We have seen a reduction in attrition, and we've also seen a reduction in losing students elsewhere when they qualify. So we are more likely to employ the students when they qualify. There's been real benefits for the students from Pebbles, and I think the really key benefit is in their confidence, students' confidence. Students feel they have much more ability to plan and deliver care. They feel more confident in their leadership skills, and they feel more confident in their transition into registered nurse. And there's a real benefit in the number of students that you can place into a Pebbles ward. So we are usually placing between 9 and 12 students per ward. Patient feedback was part of the evaluation. We know that patients certainly find the model of students providing care to them a much better model. They like to know the students that are working in the environment rather than them being a figure that sort of does a few tasks for them. They like the student caring for them holistically, and patients have been very supportive of it. We have been evaluating the programme with the University of Suffolk, and it's obviously an ongoing evaluation that we will always do after each student placement. But our initial evaluation from the few wards that we introduced Pebbles to is that student attrition has decreased, and students are more likely to go back to those wards when they qualify. They want to work in those clinical areas. So our recruitment, I'm confident that Pebbles will support recruitment of newly qualified students. I would recommend this model of supporting students because the benefits to the students, to the patients, and to the way the ward functions are huge. I think if you can have students that feel comfortable in practice, students that report their learning and the support that they receive is better, is enhanced through a Pebbles model. If you're getting good patient feedback and you know that students are leaving their training feeling more confident, and the practice staff are feeling more confident. What's not to recommend, really? We had the benefit because the Pebbles model had already really been started in Norfolk, so we actually had the benefit of looking and learning from Norfolk. So some of the things that we did was having learnt from how they did it. I think that we had some initial issues around placement, sort of timings, making sure that we had the right number of students. It's not a model that you can do with 1 or 2 students in an area at the time. So make sure that your placement numbers are aligned to that model is something that I would, going forward, would advise people to make sure that that's in place. The change of student funding is something that I've been obviously quite concerned about, and I've been monitoring, and I think a Pebbles model will help us to be able to recruit students to our programs. I think being very clear with students around expectations and having a real evidence-based placement support scheme that clearly delivers benefits to students and staff can only help in recruitment programs. This way, this model supports self-funding students. Students can measure their own learning much easier. They feel more in control, and I think moving to this model will really support the changes in funding. Our new students that are qualifying, we haven't completely seen all the benefit yet because we only currently have Pebbles in around 6 of our placement areas. So students will move from Pebbles to non-Pebble areas, which can be quite difficult for them actually, because they get used to one way of training, one way of being supported in practice, and then they move into another style. So I think we have seen some benefits. Students report feeling more confident on qualifying, but I think there's huge potential for more benefits once we have the whole trust pebbling. The other benefit that we will realise as we go forward, and we hopefully increase our number of student commissions, is that by rolling Pebbles out further across my organisation, it will increase our placement capacity and allow us to have more students. I think this model could really support the workforce plans within the STP footprints. I think it's a model that can be multidisciplinary, multi-agency. Certainly within my STP area, we are looking at redesigning the workforce to be different as we go forward, and I think the students in the acute setting, the model could be applied in other settings as well, and wouldn't necessarily just have to be adult nursing students. That you could have social work students, you could have a number of different students using this model in a different way. They are more reflective practitioners, they're more aware of the wider system working, their leadership skills will be very different to previous models of student training, and I think there's real potential there. There's real potential to enhance the leadership and to look at different ways of taking this out into other settings. My personal commitment as a Director of Nursing is to support this programme, to allow staff to have the time to go and be developed as coaches, to be able to implement the programme successfully. And also as a champion of Pebbles, I think it's really important that the organisation from a senior level down to a junior level understands the benefits of Pebbles, and that it's something that's in our workforce strategy and in our clinical education strategy as we go forward. So next steps at Ipswich Hospital with this particular piece of work is to roll it out trust-wide. We currently have 6 clinical areas, and we are in the middle of preparing 2 more areas, but I want to see it certainly trust-wide and into our community services.